Hello doctors, have a beautiful day. This is Dr. Hub, a passionate doctor mentoring worldwide. Autosomal recessive disorders, and we are focusing on the inheritance patterns here. So the mnemonic is ABCD. So it starts with A. The A stands for the ataxia, telangiectasia. Next comes A for albinism. Then there is also the alkaptonuria and the autosomal recessive polycystic kidney disease. That is nothing but the ARPKD. Now moving ahead, we look at B. B is for, it stands for the blood disorders. B for blood, and the disorders involved is nothing but the beta thalassemia as well as the sickle cell anemia. Next we look at C. C is nothing but the cystic fibrosis as well as the congenital adrenal hyperplasia. Then comes D. So what is this D? D is nothing but the deafness, that is sensory neural deafness is C. Next E. E for the emphysema, and it is nothing but the alpha 1 antitrypsin deficiency. Next we saw ABCD, and after it comes F. So F is for the Friedreich ataxia. Next comes G. G, if you see, it is for the Gaucher's and the galactosemia and the glycogen storage diseases. Then H. H is for the homocystinuria as well as the hemochromatosis. Then moving on, we look at the letter I. So I, this stands for the inborn metabolism errors such as the phenylketonuria and the lysosome storage diseases. So there are other miscellaneous diseases. This includes the Wilson's disease, the sickle cell anemia, next the thalassemia, and the spinal muscular atrophy, and the Carr-Tegener syndrome. Next there is also the mucopolysaccharidosis, and this is nothing but except the Hunter's syndrome, as well as there is the sphingolipidosis, and this is except the Fabry disease. So just to recap, we saw the A for ataxia telangiectasia, albinism, alkaptonuria, and the autosomal recessive polycystic kidney disease. Next we saw B. B is for the blood disorders like the beta thalassemia and the sickle cell anemia. Then we saw C. C is for cystic fibrosis, congenital adrenal hyperplasia. Then D. D is for the sensory neural deafness. Then we saw E. E is for the emphysema, that is alpha 1 antitrypsin deficiency. Then we saw F. F is for the Friedreich ataxia. Then G. G is for the Gaucher's disease, galactosemia, glycogen storage disease. And H is for the homocystinuria, hemochromatosis. And I is nothing but for the inborn metabolism such as the phenylketonuria and lysosome storage diseases. And we saw miscellaneous diseases such as the Wilson's disease, sickle cell anemia, thalassemia, spinal cord atrophy, Carr-Tegener syndrome. Next we also saw the mucopolysaccharidosis as well as the sphingolipidosis. So mucopolysaccharidosis exception is the Hunter's disease, Hunter syndrome, and in case of sphingolipidosis, the exception is nothing but except the Fabry's disease.